here are some of the most important tests you must do if you are trying to conceive. If you want to get pregnant and you have been going to hospital, these are some of the very critical tests that you must get done or your doctor is going to ask you to do, and they are very important. Some of them are costly, but you still have to get them done. Please, this video is solely for educational purpose. It's not for you to go and start doing this test on your own. It is still for your doctor, for your health practitioner, for your specialist to be the one to properly guide you on which of these tests you're going to do. But if you're trying to get pregnant, definitely these are the core tests you're going to do. Number one test we call HSG, which stands for hysterosalpingogram. Now, this test involves injecting a dye, the active dye, into your uterus, and then the flow of this dye is traced and filmed with a special machine, and after which it is analyzed by a specialist to give you the results. Now, this HSD, a lot of people has done it and they say they felt dizzy after they did it, and it is actually extremely painful. Most women find doing HSD uncomfortable. So this HSD can detect anomalies. So what are some of the anomalies this HSD can detect? It can detect if you have uterine fibroid. This HSD can detect if you have any blockage in your fallopian tube. This HSD can detect if you have any abnormality in the shape of your uterus. You know, some women come with congenital anomalies, like maybe from birth, their uterus was not in the right shape, but they never knew. So HSG can dictate some of those tests. If you know you've done HSD in the past, you can write your experience in the comment section. A lot of people may want to learn from you, but I know most women doesn't have good experience with that test, but then that test is critically important. Now, there are also other important tests like the test that will test for your hormone, which we call hormonal profile. Now, this hormonal profile will check the level of your hormone, check your progesterone, check your estrogen, check your prolactin, because some women may have hyperprolactinemia. If you know you've had hyperprolactinemia before, you can also tell us your experience in the comment section just for educational purposes so that other women can learn. Now, this prolactin can also prevent women from getting pregnant when it is high. And not just that, a lot of other hormones too, when they are not at the right level, they can affect fertility. So another test too that is of paramount importance is ultrasound. You may be asked to get an abdominopelvic ultrasound scan. This abdominopelvic ultrasound scan is very helpful. It can detect a lot of anomalies in the uterus. And then another important one, this one is not for the husband, though some men doesn't like going for the test, but whether you like it or not, if you are struggling with infertility, you may have to do a test we call semen analysis, where they will check the structure of the semen, where they will check the volume of the semen, where they will check the morphology. Morphology means the shape. We also check how healthy these sperms are, their structural past. We think these cells, that is the sperm cells, can be able to fertilize the egg. So it's also another important test that people that are looking for child or infertile couple may do. Please, before I give you the last one, kindly follow the page, like, comment on the video, so share to any couple you know that may need this information. Another one is what we call karyotyping. Now, this karyotyping is to check if there is any chromosomal abnormality. These cells involve studying your cells up to the gene level. We go to the deep root of where your cells that made up who you are originated from, checking if there's any abnormality, because some people may have abnormality in the way they were formed as a human being from the gene. Congratulations to you if you watch this video at this point. So go to the comment section and kindly mention any of these tests you've done.